Officially, welcome everyone to the January 27th NEMSIS V3 implementation call. We appreciate you being here with us this morning and taking time out of your busy schedules to have these important conversations and have that opportunity for feedback and input. We really appreciate that. First up on the agenda would have been Laurel, but she said that there's no maintenance this month. So we're going to go ahead and go to the next one. But I forgot some maintenance. I forgot some housekeeping. I just want to make sure everybody's aware that the session is being recorded, and we put these up on the website and also on our YouTube channel so that they're available to you to review later. Next on our list would be the ET3 update. If we have John Beckett and Neil Milan with us, we'd love for you to take a few minutes and provide an update on ET3.
Hey, Julianne, this is John. Can you hear me?
Yes, you sound great.
Okay, great. And if I could just share my screen real quick as well, that would be great.
Yes, please go right ahead.
Okay. All right. Just a few updates, nothing that's going to take up a lot of time. Just wanted to let a few folks know that we have successfully onboarded a number of participant/vendors, and currently we've got 6 users that are approved for ET3 security keys. So I think that's that's a good start. Obviously, there's a lot more users that will be coming through. We anticipated that this would be kind of a slow rollout, but in February we expect there's going to be the bulk of the registration that would be accomplished by most of the participant and vendors. Just as a reminder, I just want to make sure everyone understands the initial ET3 data is going to include any of the PCR data that was captured in January of 2021, as well as we would like to get historical data. And that date range is from March the 19th through February 2020. So we are excluding a large portion of the 2020 year. And please let us know if you plan to send in the data that we're requesting from a historical standpoint. Please let us know if you plan to send data that's going to be outside of that date range. I've already talked to one of the vendors that gave us a heads up that they would be providing us with a bulk set of data that represented the 2 years, 2019 and 2020. And we're prepared to accept that, but we just would like to get a heads up from you before you send it. And again, we're just looking for historical data from March 2019 through February 2020. The due date for that initial ET3 data is the end of February. So we have time that, we have pretty much one more month here that we can look for you to send that data in. So those of you who haven't onboarded yet or are still looking at doing this task, we would encourage you to go ahead and get started in the next week or two. In terms of our data submission, we do have one vendor that we have received PCR data records on. One of the things that I would encourage you also, there's a tag that's a part of the record, the PCR record, which captures the organization name. And so some of you may not think that it's important to put a value there, which is going to be reflective of either the vendor's company name or the participant's name. But I encourage you to use that tag to correctly put in a name that would be associated with the PCR records. We certainly can do a cross match to determine where that PCR record is coming from. So don't think we wouldn't be able to do that. But initially when they come in, that tag is partly what we use to identify where that record is coming from. So if you have an accurate name there, we can very easily determine who that's coming from. So I encourage you to just take some thought in what you're putting in the tag that is the organization name. In terms of the help desk contact information, I kind of went through this before. I just want to reiterate that we do have a number of help guidance out there. The webinar is there. We have a guide that's out there also. And this is the help desk support numbers that you should be using. So I have gotten some calls from folks that might be using a different help desk that CMS has. But just to reiterate, this is the ET3 help desk for general inquiries. So if it's from a business level and you have some questions, feel free to use this. If we're talking technical help desk support, this is the phone number that you would want to use in order to get the support that you're looking for. And then obviously NEMSIS is going to be there for you, as well as Neil and myself. And I'll make sure that our email addresses are available to you as well.
John, can I interrupt you real quick? Could you go back to the previous slide? We've got just a couple of questions in chat. A question about, are you wanting all the records in that date range or looking for specific types of incidents?
Yeah, that's a good question, and we've had that question come across as well. Hey, Neil, are you there? Okay, so yeah, we're looking for all the records. That's the answer to the question. So we're not expecting that you're going to filter that list, but we are requesting all those records come through for that date range.
And then another question, when you were talking about the tags, which tags specifically were you referring to?
So these are, there's some in the spec, which, just to give you an example, there's a username one, there's a password one, and there should be one where you put the organization name as well. And I'll get the spec out and just detail that out. And we can send that out in a subsequent email. We do plan on having some guidance papers generated, and maybe that's a topic that we should cover in a guidance paper. But yeah, the organization name is one of the tags. I keep calling it a tag. That's one of the things that is being sent on the PCR record, and it's identified by the organization name.
This is Josh. Just to clarify that a bit, that's in the SOAP message.
Yeah, that's right.
Yeah, so it's outside of the NEMSIS EMS dataset document.
Thank you. Thanks, Josh. Thanks, John.
Okay. Okay. The last couple of things here I have, just reminders and tips. There is, again, multiple steps you're going to take in terms of completing the onboarding process. So when you are walking through it, just bear in mind that you have two very important approval steps. One is when you are approving for a role, and the other one is when you're approving for the security key access, or excuse me, security key request. Those are two steps that are very important. The role requests, for most of the requests coming in, you should be looking at the APIR requester role. And that is the one, again, that allows you to set up your security keys. It'll
John?
also, yeah.
Yes, sir, John, your slides aren't progressing. Is there slides associated with your discussion? Yeah, sorry about that.
Yeah, yeah, and actually, do you see my ET3 update slide? Is that what you're looking at?
Yeah, just slide 2.
Yeah, that's the one. The other slides I'm actually not going to go into. I'll just keep this brief. But yeah, I'm just wanting to finish up this one here with the reminders and tips. So I just wanted to, just outline, and I can give you some of these in the slides when I send it over, and you can distribute that out. But I just wanted to kind of cover just a couple of the tips that I had for you. So again, the steps are important just to keep in mind, and then the the other part of that is the requester role. That you want to make the APIR requester role the one that you want to ask for. There is another role that you can certainly ask for that will support the viewing of the data once it's been submitted. And that one, typically the participant would be signing up for that role. Software vendors typically would not be signing up for that role. So I'll put this all in a slide and send this over for distribution later. But I did want to just cover a couple of tips there. And I'll just leave time for open questions. I see Caitlin. Caitlin?
Yes, sir.
Yeah, go right ahead.
Yes, sir. Your favorite thorn in your side about this. Every time I go through the onboarding process, I get confused again. And I'm thinking that if that's happening to me, it's probably going to happen to our vendors.
Mm-hmm.
So what would be amazing would be if there was a walkthrough document on the ET3 website, because vendors, the first place they're going to look is on the ET3 website, the one that has all those nice documents in one place. And they're going to say, how do I sign up? How do I sign up for the data side, the data portion, which is what you're talking about here, the onboarding process. They're going to look for a walkthrough document that says, step 1, vendor does X. Step 2, ET3 does this. Step 3, software provider does X. Step 4, it would be, the process would be broken down by who is responsible for which step. Because right now I can't keep it clear in my mind which parts we're going to do or we might be asked to do as the software vendor versus which parts we should tell the provider, look, you can do that yourself. Here's the information you need and here's the link. So right. I would love it if there was just a perfectly clear, this is the way to do it and this is the only way to do it. Here's who is responsible for every step. Here's how you know you've done it before proceeding to the next one. Because otherwise my phone is going to melt when this goes live.
Sure. Okay. All right. Let me take that back. We do have the data submission guide that is available, and it does walk through it just like we did in the testing cycles back in November and in December. But I'll take that back. We didn't really specifically target that document for either a participant or a vendor. We just thought that you guys would be able to determine what functions you wanted to sign up for, and therefore would use the document, in a way that would allow you to achieve those functions. So let me take that back, and we'll see if we can improve on the document that's there and make it specific to either the vendors or the participant. Is that what you're asking?
Yeah, and I want to add that. Here we are surrounded by the comfort of computer geeks, and everybody in this call is technical, I think. But probably most EMS company owners, the owners, and sometimes even their directors of billing are not technical. And if you ask them for an IP address, they're already getting ready to pick up the phone and call somebody. So this walkthrough document, ideally, would be targeted at them. It would say, it would be in extremely plain language. Here's the URL, click here, type this in, request this piece of information from your vendor, type that in. It would have to be for non-technical people to complete this process, assuming that's even possible, and that might be an impossible dream. But that's who is going to be investigating the ET3 program. It's going to be it's going to be the owner of the ambulance company who is looking into this stuff, and is either going to be configuring it on his own or he's going to tell his billing director to do it. And she probably knows everything there is to know about billing, but she probably only knows as much as she has to about software and cloud services and things.
Sure. Okay.
Caitlin, this is Kelly from ImageTrend. I'm not sure if this would be helpful for you to not, but I just kind of wanted to provide what we were doing. So I created a document that outlines the entire process to register. And I've also included our outbound IPI address on that, as well as the webinar. And I told them start at minute 12:48 seconds in. That walks them through the entire registration. And then I actually work with them to take that API key and put it into the system. And with that document that kind of gives them all the resources they need, as well as the ET3 support, they're able to do it. And we've been able to successfully submit some records. So I don't know if that would be helpful, but I would be happy to send you that document if that's something you'd be interested in seeing how we did it. Would that be helpful?
I would love to just copy that document and just claim it for myself and modify it for my own use. If you guys are so awesome as to be willing to share your work there, I bet everybody in this call would love to take that as their starting point.
I will see what I could do. I might have spoke too soon, but let me check with my leadership and make sure they're okay with that. And then I'll be happy to share that with you.
Yeah, well, that's amazing for you guys to offer.
Yeah, absolutely. It seems to be working out pretty well, so knock on wood.
You know, I wish there was a way for then maybe, assuming that we all get to benefit from that document, I would still love it if the ET3 website had some kind of link or generic walkthrough for customers who say, okay, I did the administrative part of the sign up. Now I want to do the technical part of the sign up. What do I do? I wonder if if there was a generic version of what you've done, or some kind of pointer to a page of links to all PCR vendors who have, let's say that everybody copies your document and dresses it up for their own software. ET3 could then have on their website a link to each of those. So a link to my document, a link to yours, a link to everybody's. Because I have a feeling that my customers are going to start at the ET3 website looking for sign-up help. And then if they could then find my document from there, that would be amazing. What do you ET3 guys think? Are you willing to do that?
So Caitlin, let me take back your request here, and let me talk it over with Clay and his group as well, and see what the best approach might be. But I think we can, take a step to help you with, getting the communication right that you need to have to your participant customer. We're here to make sure that you correctly get onboarded. So whatever we can do to help you with that, we'll certainly do that. But let me take it back to the group, and we'll get back to you and let you know.
Hey, John, this is Eric, and Caitlin, as one of those persons who found himself in a leadership position with a non-technical background. I resemble that remark, and I appreciate those kinds of documents as well. And Clay and Julianne help me out with that all the time. If you will please just take a couple minutes and send me a very succinct, this is what I would like to see in that document. We will work with whomever, whether it's Image Trend or the TAC, and certainly with the ET3 folks, to put together whatever you need to make that simple. Because you're asking, and you're dead on, you're the first person to ask. But right now we're at 200 participants. As this thing expands up, there will be others that have the same questions. And I would rather put together a document and address that right up front. So please just, and others as well, if there's something specific that you think should be included in that, just straight up, it needs to tell us this, and we'll work on getting something together for you. Thank you.
Okay, so are you asking me and others to send you an email with our wish list for for what this document would have and how it would be published?
That's a good way to say it. Yes, ma'am.
Okay, will do.
And again, very succinct. I mean, I'm not looking for you to do the legwork. I just want to know, again, as the non-technical person, what things you want addressed. Because when we look at things from the tax side and from the ET3 side, we look at it from what we need. But I need to hear what you need.
Roger that.
All right. Any other questions or comments anyone has? All right.
John, this is Samantha with ESO. At one point, I thought you had mentioned that there would be a list of participating agencies that have completed their participant agreements that we could use.
Mm-hmm.
Is that available yet?
Yeah, let me go back. That is something we have generated,
Okay.
and let me just see where it will be, where the best place to distribute that would be. You know, I know any communication coming out of CMS, there's a team that's involved before that gets sent out. So let me take that back, and I'll see I'll see what the right distribution for that is. And it might be something as simple as, we can give that list to the TAC, or excuse me, to the NEMSIS folks here, and they publish it as well. So let me go back and see what the answer to that question is. I'll get back to you, Samantha.
John, once you have the answer, please let us know, and we'll distribute it through the TAC and work with NEMSIS, so that goes to the data managers and the state directors.
Okay.
I would also like to get it out to the vendors on this call, because my fear is that there's some agencies working on this process, and they're not maybe including their vendors to the degree that they should be.
Mm-hmm.
And all of a sudden they're going to blindside them and say, hey, we need to get this done. And, everybody's busy and everybody's on a timeline. So as much notice as possible would be great. So anything you can do to get us that list would be greatly appreciated.
Okay. Yep. I've got that one written down.
Also, I'm sorry, go ahead.
Good one.
Yeah, we had a question regarding agencies that are supposedly participating in ET3 that said they're from Florida, but they're not licensed by us. So they're not going to have a D agency 01 or 2 or anything to do with us. How do we handle those agencies?
This is Clay. That's interesting. So, could you describe that? It's a EMS agency that functions in Florida that's not tracked by the state or certified.
We have agencies that will work under somebody else's license number. So the county might have a license, but they operate under the county license as an independent agency. So we don't license them directly. We license the county, and the county works with the agency to get them set up.
Oh, interesting. So when they're set up, do they submit to the data to the state of Florida?
They submit to the county, and then the county is responsible for submitting to us.
Okay. When they submit to you, do they have a value for D agency 01?
No, because they use the county's license. We only give those to the county.
Okay, so those come in a blank.
Correct. No, they don't come in blank. They'll come in with the county's number. But we don't know who that agency is. So if you give us their name, we're not going to know who they are.
Oh, okay. Would that number that's recorded in D agency 01, that county assigned number, that would be unique to that agency though, right?
No, just to the county.
Oh, so multiple.
Yeah, we could have 19 different agents, fire districts operating in one county, and all of them are one agency.
Oh, okay. Okay, that's interesting one. That's helpful information for Monet to know on our team as well as us. Yeah, well, we may have to work through that a little bit to see what to do there. So thanks, Juan.
Juan, this is Eric. Does the county then bill, or does the agency bill?
It would be the county or the agency. It depends on their agreement between each other.
Okay, because I am familiar with some other states where the county is billing for multiple agencies that work kind of under their purview. Yeah, Clay, we might have to walk through that one a little bit with John and Neil to make sure that we're going to be able to account for them the way we need to be.
Yeah, thanks. Yeah, thanks, Juan. Appreciate you bringing that up.
This is Josh.
And there was another thing with agencies such as AMR, they applied for ET3, or I'm just using them as an example. I'm not saying this happened with them, but they have 5 agencies within Florida. So as one organization, they applied for ET3, but they have 5 different licenses.
Juan, this is Josh. Did you get a request from Monet to verify some agency names and numbers?
Yes.
Okay, great.
So Juan, yeah, we may need to reach out to you individually and talk about those. We have that same kind of situation in other states, like you mentioned with AMR, but each of the agencies in those other states that are working under the same company all have different D agency 01s, and that's not the case in Florida.
No, I mean, that is the case in Florida. So we have 5 different agency numbers.
Oh, okay.
All of them have their D agency 01. The agency 03 is different.
Okay, we're good. We're good then for those. But yeah, the other, the county assigned we'll have to work through.
Okay.
Yeah, thanks, Juan. That's really helpful.
Are there any other questions for John and Neil while we have them?
Hey, Julianne, I have one quick question for those guys.
Mm-hmm.
A couple of weeks ago, we kind of discussed the possibility of allowing customers or providers to be able to request their own API keys and sort of taking the vendors out of that middleman situation. Has any more thought gone into that, John and Neil?
Yeah, so the system does allow you to work with either model. And when I say either model, what I mean is the one you just communicated, Keenan, where you leave it up to the participant to sign up as well as request the security keys and manage those keys. So the software vendor doesn't need to do anything. They're just going to receive those keys and make sure they're used to submit PCR records. And then the other model is, yeah, we can have sort of this dual request made where you've got one user representing the software vendor coming in, making the requests just for the security keys, and then you have the participant coming in, and really they're just looking to use the system to view and in some ways manage those records downstream. The system supports both. And what I would like to do, if you are thinking about a model, I think you and I had talked originally, and you guys were thinking where you're a software vendor supporting multiple participants, you would go in and make those requests for the security keys across all of your clients. And we have a group internally set up here at CMS that is prepared to, sort of be there so that that bulk request can be satisfied in one time frame, as opposed to just trickling in. So I think right now we can support that model. I did receive some requests from a couple of your clients separately for security keys, and I also have requests that are queued up right now, as you know, from last week, that we are prepared to send through when you're ready to get on the phone with us. So we can support both. And I just sent an email over to you and Peter. So if you guys are ready, just let me know, and we can, get all those approvals through, and get you started.
Awesome. Thanks, John.
Yep.
Any other questions?
Yeah, John, there's one question in the chat from Ben in EPR Fireworks. It's not necessarily a question, but he did provide a URL where there is a selected list of participants available on the CMS website, participants for ET3. Is that an old list, John, or?
Yeah, I'm thinking that might have been a list that was published back in 2020, and it. We went through this iteration in 2020 where we were ready to go live in June, and then we got pulled back. So yeah, I think that might be an older list, but I'll double check. And again, we'll update that list, or we'll make it available, through some other websites as well. So we'll update that. So thanks a lot for that, though.
All right. Next on our agenda, Clay's going to take some time to talk about data sharing request.
All right, great. Yeah, this is primarily directed towards the states. Wanted to remind the state folks that 2 letters have been sent to your EMS organizations there within the state from NEMSIS. These are letters that are asking to extend our data sharing agreement that we have related to the COVID pandemic. So our ability to share with states the rates of influenza-like illness symptoms among the patient contacts that EMS services every day, and allowing states to see what's happening along their borders, right? So they can see if there are hotspots across the borders. And so just remind you, here's the 2 letters that were sent out, one by Dr. Sim, the lead for the Healthcare Resilience Working Group, and then also a letter from Dr. John Kramer, asking for an extension on the ability to use that data and share the cross-boundary data with states, and so that they can better serve their EMS needs. That ILI dashboard has been available and has been used to a great degree, so it's been incredibly valuable. This request really has 2 requests in it. One is to just extend the current ILI data sharing agreement through December 2021. So just the 40 states that have agreed to this, and there's other states that want to participate. Whether or not we can just continue with that data sharing so that the states can see that data. And there's also a second request to release a selected number of other indicators that would allow states to have an EMS by the numbers tracking system, and also be able to surveil some EMS system times that weren't included in this first ask. So I'm just going to walk through that real briefly. This is a document that Emma requested, so we're almost done with this, Emma, and we'll send this out. She asked for these 2 requests, could you share with us exactly what data is being requested to be shared among the states? Still password protected, still available only through state systems, through state NEMSIS passwords, but also available to federal entities that are approved by ERIC and the Office of EMS. But what specific data is released? So right now, the ask to just extend the current ILI data sharing agreement, these are the elements that are released and shared in that ILI dashboard. So we allow the data to be shown at the county level. There's some patient demographic information. It's mostly related to complaints and symptoms, right? So we can identify ILI patients, influenza-like illness patients. We do have a couple of elements related to the EMS response, and so the unit notified dispatch date and time, that's just so we can have a timestamp on how many of these type of cases are occurring per day. And then we also display in that dashboard whether the patient was transported to a hospital or to some other alternate destination, just so that states will be able to track that type of information. So that's what's released right now. What's not released, of course, is all this other data, right? We don't release any information regarding the patient's home or the incident location, right? So, which may indicate a hospital in zip codes, for example. No information about the agency, and of course, no information about any of these sections of NEMSIS regarding patient care, excepting for the things we mentioned above. And we do, as folks know, allow you to look at naloxone administration. So that's the only caveat to e-medications. Otherwise, all these sections, none of the data in them except what we've talked about above, right? So we have the 4 elements for symptoms and impressions and the one-time element. The second ask is really only for some limited additional information. And this is being requested so that we can track a new trend that's been troubling, and that is extended offload times for patients that arrive at the emergency department, long extended times before the patient is handed off to the ED crew. And so to do that, this additional ask requests that we're able to do basically the same type of a dashboard where states can look at their state and neighboring states. And so they can see if there are long offload times, like right across the border into a different state. But by zip code, and we do that because our identification of hospitals, we don't collect hospital names at the national level. As close as we get is the zip code of a destination. And so that's why the request is a little bit more descriptive of the geo measure rather than county at zip code. And then you'll see we're just asking for a few additional times that allow us to calculate an elapsed offload time and an elapsed back in service time. To give you an example, so here's the map that's been developed and will be rolled out to states. And depending on the outcome of this letter and request, if that second request is denied, you'll only be able to see your state, but you will be able to see your state for offload times and for turnaround times. If it is approved, you'll be able to see your state plus the neighboring states to help you better kind of look at what's happening across different regions of the surrounding area to your state. So it's a dashboard that's very similar to the ILI dashboard, but just allows you to help your agency and leadership there at the state be able to look at where there's long turnaround times and long offload times. So that's the purpose of those 2 letters. And I will stop there and ask if there's any questions, or Eric, if you want to share any additional information regarding that. Okay. I wasn't able to make the last DMC call. For the states, Eric and Julianne, who's collecting the responses on those 2 requests? Is that Hannah?
Yes, Hannah and Monet.
Okay, so when your state's ready to respond to either of those 2 requests, if you'd send those to Hannah, who is the kind of the person who takes care of all the administrative stuff for the DMC, or to Monet, I hear, who works directly with states. We'll make sure that information exchange between those 2 people. So any questions from the states regarding those 2 formal requests?
And I'll throw those emails in the chat in just a minute. So those are easy for you to get to. Next on the agenda, I'm going to turn some time over to Monet for the next 2 items, plans to transition to 350 and then closing out the 2020 data set.
Greetings, everyone. So as mentioned, and it was mentioned on the call last week, or sorry, 2 weeks ago, we're attempting to collect the long-term plans for each state to transition to the 350 standard. The goal is to collect the information and have it provided on the state pages of on the website. transition to 3.5 so that we can have that information available for the states. So I am going to add the link again to the chat, and I apologize, last time it didn't work as well as I intended. So let me drop that in the chat for all. And if you could just take a few minutes and just answer 5 questions, we would love to be able to, again, provide this, the results of this information on the state pages. And so one other thing I want to mention is the TAC will no longer accept version 3.3.4 after August of 2021. So I appreciate that some folks have already started addressing this question. I did mention on the last call a date sooner than August, but the true date is August. And there's still approximately 10 states that are exclusively submitting version 3.3.4 data. So please send us an email with your questions or concerns, or if you.
But from a national perspective, the prioritization of EMS to go out and do vaccine distribution as a primary point of contact is not highly anticipated at this point. However, there are people, I'm one of them, that are speculating it's going to be like everything else. Once the hospitals are overflowing, we can't deal with it, EMS will step in. When the nursing homes were overflowing, they were looking for help, they went to EMS. When we had a flood of people coming across the border, we needed other people to do screening, we pulled in EMS. You're playing for the utility player. So, you know, I can't tell you where to prioritize it within your organization. And I wish I had more, but to be honest with you, things on the COVID task force are going day by day. I know tomorrow at 11 o'clock, I would tune in to the first COVID task force public, basically it's the first time the COVID task force under the new administration is going to do sort of a public speech and provide information. I don't know if they'll do questions and answers, how big of a press thing will be. I suspect it'll be pretty big. I think it's tomorrow morning at 11 o'clock on Eastern Standard Time. You can certainly Google it and find it.
Awesome. Well, that's more information than I had, so I appreciate everybody. Thank you so much.
And there's some comments in the chat too from South Dakota, Pennsylvania, Massachusetts as well. Any other states want to weigh in on that question from Peter? And are there any other questions, comments, concerns that anyone wants to bring up during this time? All right. Feel free to send us any feedback, input, questions, comments, concerns. We're happy to address those, whether they are individual or in the meeting. New ICD-10 COVID codes, Elizabeth with Zoll. Do you want to expound on that a little bit? That started 1/1/21. Okay. We will look, we'll pull that announcement and look at those. Is anyone else utilizing new ICD-10 COVID codes? So EPR Fireworks is utilizing them.
Yeah, Julianne, this is great information. Elizabeth, if you'd be so kind as to maybe share that that link. I just through one of the ICD map programs, there's some announcement from CDC. I imagine these aren't U codes. They must have the new actual virus codes. That would be great to know. Yeah, thank you.
Yeah, this is Josh. I'm just taking a quick look on the CDC website, and it looks like they published new codes on November 30th that were to be effective January 1st. So that's probably the ones Elizabeth was mentioning. We'll take a look at them.
Great, thank you, Elizabeth. Oh, great. Yeah, thanks, Frank. Wow, great.
Okay, yep, that's the link I'm looking at.
Great.
Perfect. Thank you. Thanks for sharing that. We'll pull those up and take a look at those. Any other questions or comments? Okay, we'll leave the chat up a little bit so that you guys can get the links that have been shared there and make sure you catch that conversation in the chat as well. We also capture all that. We really appreciate your input and comments and suggestions. Our next meeting will be in February. We always do them on the 2nd and 4th Wednesdays of the month. And we send out those notifications through the Google group. So if you're not receiving Google group messages, give us a holler and we're happy to add you to that email list. Thank you everyone for being with us today and have a terrific day. Thanks.
Thanks everyone.